When we think of the impact of deployments, we think first of our service members. However, they are not the only ones who bear the burden of sacrifice. Currently, nearly 1 million children in the United States are affected by military deployments. As Associate Director of the Center for the Study of Traumatic Stress and Professor of Psychiatry at the Uniformed Services University of the Health Sciences, Dr. Stephen Koza is working to bring the impact of deployment, injury, illness, or death on military families to the forefront of national attention. Much of this work is focused on helping the children of our brave warriors. Most of our military families, especially children, function primarily within the civilian population, a population that, by and large, does not understand the unique challenges faced by military spouses and children. Himself a 25-year veteran of military service, Dr. Koza is pioneering research into the effects of trauma on our service members, as well as their spouses and children. Dr. Koza is acutely aware of the need for the military to reach out to civilian groups and provide them with information and tools to support military families as they cope with the burdens of war. In addition to his role at the Uniformed Services University, he serves as an expert scientific advisor to several national organizations focused on the needs of military children and families. Recently, he was instrumental in helping the Sesame Workshop develop their widely acclaimed Talk, Listen, Connect series for military families and their young children. Dr. Koza's work to bridge the military and civilian health communities exemplifies the powerful impact of leveraging resources from both communities to improve care for all. Through his tireless efforts, he is helping to ensure that our military families receive the support they need and so richly deserve. Colonel Paul Pasquina's enduring commitment to his fellow service members is helping wounded warriors not just survive, but thrive. A graduate of the Uniformed Services University of the Health Sciences, Colonel Pasquina is Chief of the Integrated Department of Orthopedics and Rehabilitation at Walter Reed Army Medical Center and the National Naval Medical Center. Throughout his career, Colonel Pasquina has demonstrated a combination of vision and leadership that have helped to transform the military medical system's rehabilitation programs. His belief in the need to embrace new technologies and partner with private institutions, as well as employ a more holistic approach to rehabilitation, have helped to create a world-renowned prosthetics and rehab program for our wounded warriors that is truly state-of-the-art. The impact of Colonel Pasquina's work is evident not only in the military system. These new technologies are improving outcomes and quality of life for civilians as well. Colonel Paul Pasquina has positively impacted thousands of lives, and his work has helped to provide hope for service members and civilians facing some of life's greatest challenges. Jenny McDevitt was diagnosed with a glioblastoma on September 15, 2003. Her son, Jack, was just 8 weeks old, and she was faced with a challenge that no person, let alone a new mother, should have to face. After her first brain surgery to remove the tumor, she realized that she still had a lot of living to do and began her quest, jogging for the noggin. Training not just for a marathon, but for a mission, Jenny completed the first of 7 marathons, and still counting, in April 2004, less than a year after her diagnosis. She made a promise to herself that she would continue to run a marathon every year for as long as her brain and her feet would allow her. Incredibly, Jenny has run all but 2 marathons while on chemotherapy. In 2007, Jenny ran the Chicago Marathon and then the New York City Marathon just 3 weeks later. In 2008, she did the same thing again. She is a firm believer that you can do whatever you put your mind to. In addition to her personal victories, she has shared her success and hope with the brain tumor community. Her accomplishments have been recognized with awards ranging from the Saucony Woman of the Year Award to a feature role in an Energizer Bunny TV commercial. After completing the marathon in 2007, Jenny was featured on The Today Show. As a vocal and inspirational advocate for research and the Tug McGraw Foundation, Jenny has spoken to members of the FDA Oncologic Drug Advisory Committee and to brain cancer and hospital organizations across the country. One of her proudest accomplishments has been bringing her own love of running to the brain tumor community by bringing Joggin' for the Noggin to life with help from her husband, Glenn. In its second year, the 5K run held in her hometown of Palatine, Illinois, included more than 800 runners and has raised over $75,000 for brain cancer research. While serving as a United States Marine in Iraq in 2004, Lieutenant Colonel Timothy Maxwell was gravely injured when a mortar round exploded, sending 2 pieces of shrapnel into his brain. The first thing he told his wife after awakening was, "I want to be with wounded Marines." Since making a remarkable recovery from his own traumatic brain injuries, Lieutenant Colonel Maxwell has become a vocal advocate for battle-wounded service members. He spearheaded an effort to found the first Wounded Warrior Barracks, a facility at Camp Lejeune, North Carolina, where injured active-duty Marines recover together. Since then, another Wounded Warrior Barracks was opened at Camp Pendleton, California. Lieutenant Colonel Maxwell also created SemperMax.com, a website where injured warriors all over the world can go to connect with and support one another. Timothy Maxwell has been featured on television and in print, in publications including Esquire magazine and the LA Times, but much of his time is spent doing what is most meaningful to him, visiting wounded Marines and offering them a very personal message of support. On June 26, 2009, Lieutenant Colonel Maxwell retired from the Marine Corps after 22 years of service. At his retirement ceremony, he received the Legion of Merit for his dedication to his fellow service members, along with a standing ovation from the crowd. "I've learned that being alone is the worst," Lieutenant Colonel Maxwell has stated. In spite of his retirement, he plans to continue his work. "The solutions are out there," he said, "but wounded guys don't know about it. I have to spread the word."